Hello everyone. In today's Explain Why series, we are going to understand a concept, that is why plasma levels of FSH, that is follicle stimulating hormone, is markedly elevated. It is going to be in high levels when you take the blood samples of the post-menopausal women. So here the key is, in post-menopausal women, why FSH is going to increase. The answer is pretty simple, because in a post-menopausal woman, what is going to happen? The levels of estrogen and progesterone are going to come down. So from the ovaries, the estrogen and progesterone production is going to come down. So whenever the production is coming down, the pituitary response, that is the estrogen progesterone, usually when their levels are high, they are going to tell the pituitary to decrease the levels of FSH, because whenever adequate levels of estrogen and progesterone is going to be there, it is going to give a negative feedback and inhibit the levels of FSH. But in a postmenopausal woman, the levels of estrogen as well as the levels of progesterone are down. So there is nobody to give feedback inhibition to the pituitary to reduce the FSH. Now, what is going to happen to the FSH? The FSH is thinking that it has to go and produce more and more estrogen and progesterone. But right now there is a problem because of the ovarian follicular exhaustion which happens in postmenopausal women. It is not going to produce estrogen and progesterone. But now the FSH will try to increase its amount to give little bit of estrogen and progesterone, whichever is able to possible production is happening in the ovaries. So that is why this level goes to very high levels, because of the laws of negative feedback control. Not only that, even the levels of LH, because luteinizing hormone is again under the influence of feedback influence of both the estrogen and progesterone, that is also going to increase markedly, but still the levels of FSH is going to be at a very high rate. And not only that, there is an inhibitory hormone which is produced in a normal status also, that is the inhibin. That inhibin also is going to come down. So what is going to happen? Estrogen is down, progesterone is down. They are also not giving any feedback, and even the inhibin, it is also not inhibiting the levels of FSH directly from the pituitary. And that is why the plasma levels of FSH are usually on the higher side for a post-menopausal women. I hope it's clear. Thank you for watching the video. We'll see you in the next video. Thank you so much.